Welcome to Ovary-Acting, your ecosystem for all things women, where we take your health and wellness seriously, but ourselves, not so much. I'm your host, Dr. Jennifer Ashby, clinician, acupuncturist, researcher, and your guide through this female journey. Why are we doing this podcast? Because you deserve a life revolution, one where you feel informed and empowered, but also where we can discuss and laugh at the ridiculousness of it all. This is a place where we call out the elephant in the room. So if you want some smart talk with a wink, stick around because we're about ready to shake things up. Today, I am thrilled and honored to welcome one of my best friends, Erin Burke-Lance.
Hi,
Erin,
Jennifer.
welcome to Ovary-Acting.
Thank you.
Today, we're going to talk about vaginas and vaginal health because I don't think we talk about it enough. And when I was thinking about what are the two most important parts of female anatomy, I came up with boobs and vaginas. So Erin is here to talk about vaginas with us. But first, I want to give her a proper introduction. Erin was born in New York City. She had the good fortune of a difficult birth herself. After many hours of long labor, her young mother, exhausted but defiantly against having a C-section, Erin came into the world, pulled by forceps and looking up instead of down, like most babies. She would spend her young life growing up with hippie artist parents in New York City in the 1970s, living in an old carriage house from the 1800s with her parents and a roommate. The rent was very expensive at $225 a month. It would be another 11 years before she had her next experience with birth and was 10 years old when her mother turned to midwives when she was pregnant with her younger brothers. Her younger brother, Brendan, was born at the Childbearing Center in New York City when Erin was 11. 4 years later, she would witness the birth of her youngest brother, Guy, at the same birth center. These experiences with birth informed her future career as a nurse midwife. As a floundering senior at Smith College, majoring in religion and biblical literature, which I did not know, she attended a January term course on midwifery and home birth at nearby Hampshire College. In this month, she started to think about becoming a midwife herself. However, having no work experience with anything medical, she decided to turn to the Childbearing Center in New York City and work there as an assistant midwife. Life and a boyfriend took her across the country to San Francisco. She received her master's degree in nurse midwifery in 1998 from UCSF after the birth of her own daughter, Story. Story was born vaginally as a footling breech at UCSF at a time when breech birth was moving towards C-sections. Yeah, less and less doctors were willing to perform them. Starting in 1998, Erin had the honor to care for women across their lifespans in clinics, as well as attending births in homes, birth centers, and in hospitals. Her son, Eamon, was born at home with midwives in 2000. That's when I met you.
Mm-hmm.
Yeah. In 2005, Erin was part of the founding of a group prenatal care program, Centering Pregnancy, at Marin Maternity Services. In 2011, Erin joined Marin Health and became the OB program manager for the Marin Community Clinics for 12 years, continuing Centering Pregnancy in this new clinic setting. Since about 2017, Erin had the privilege of starting the challenge of menopause, followed by a breast cancer journey in 2024. In 2025, she retired from birth work. Her professional life has pivoted to focus primarily on the care of non-pregnant women with a focus on menopause. In 2006, she also began a journey to become a professional homeopath, a whole new chapter for her of working with women and advocating for us. Thank you so much.
Yeah.
Welcome. So I thought we'd start by just blurting out all the names we thought we could come up with for vaginas. First, do you want to show your vagina?
Yes, I will
Erin's
show my
going to show
vagina.
us her vagina. She brought one today.
This is a Sheila gig. And these are actually like ancient, they were carvings on churches.
They were like the entryways to places of worship, I think all over Ireland and where else?
And lots of parts of Europe too. I think a lot in Ireland is where they've been found.
Mm-hmm.
And as you can see, it's, a figure with her vulva, like she's opening her vulva, and it's a very powerful image, right? And I feel like this is something that in this time as women, we should reclaim like this power that we all hold. This is something that's, part of all of us, right?
We give life.
We give life.
This is the honoring of our giving life. And I've heard that a lot of these Sheilas have been destroyed, actually.
Yeah. Yeah. With the advent of like, Christianity and Catholic Church, these images, but they still kind of interestingly do show up.
Some exist out here.
Yeah. I'd actually love to do a tour of Ireland and
just take pictures,
see the Sheilas. Go check them out.
So let's come up with all the names for vaginas that we can come up with. What's the slang?
Okay. So like there's, I was laughing because there's this song that's by Drake where it's like, let your coochie breathe. And I was like, oh my God, this is a brilliant song. I need to play for all my pages. So Coochie, I'm going to start with Coochie.
Coochie. And then what we called him when we were raising our children together.
Yes. Yoni.
Yeah. And then we've got pussy and cunt, two of my favorites.
Yes.
Cunt is often also used for things other than vaginas. Although I just wrote about in my book that the origins of the word vagina have nothing to do with it being like a birth canal or a place of giving life. It was actually so stupid. It means a sheath or a scabbard, a place to hold a sword. Could you imagine a vagina just being a place for men's swords?
Yes.
So short-sighted. We are so much more interesting than that. Which I often say a lot when referring to terminology. I just wrote a Substack called a response to the term cougar puberty. God, say that 10 times fast.
I read that. It was good.
And I was like, seriously? Like, not that there's anything wrong with chasing younger men, but we are so much more interesting than that.
Yeah.
Anyway, so we got yoni, we got vagina, we got cunt, we got pussy, we got yoni. I mean, I'm sure there's a whole bunch more.
I think there's a ton more. One of them, so for a lot of my patients who are Latina, and they sort of refer to it as like their intimate part. Like mi intimidad, mi intima, mi intima. And so there's sort of like, it is.
Like powerful and intimate.
And intimate. Yeah, it is powerful and
just
intimate.
like a woman.
Yes, exactly.
And you, so during Erin's time of assisting births, you were actually in this room with me as I birthed my last child.
That's
right here.
Right. Oh my gosh.
So Ovary-Acting takes place in our living room, on our couch and on purpose, with me not dressed up and fancy. Actually, I'm going to tell a quick story. So this shirt, I don't know if it was intentional or unintentional, but I absconded with it because I've coveted it on my friend Katie for years. And I went to one of her twins' soccer game, and somehow it ended up in the back of my car, which I didn't notice for months, actually. And then it's been probably 2 years now. And I finally just let her know, like, I think I have your shirt. And she's like, bring it back. So I love that shirt. I'm like, I love that. So it's got the torn pocket, but it's this really thick denim and it's really warm. So I'm wearing it today because, Katie, I'm planning on actually giving it back to you. Is there anything you want to add to that intro about yourself? I mean, you're a kick-ass midwife. You're a kick-ass clinician. You're a kick-ass friend. What else do you kick ass at?
You know what actually struck me when you were reading that was just like, I am standing on the shoulders of so many women. And it makes me like, I actually choke up in it because like, I didn't found group prenatal care centering pregnancy. And like, I wish I could remember the name of the amazing midwife who really started that. But it was really the idea of it is bringing women together in community. Right. And yeah, I think that I just was really kind of struck with like, I am here because of all the women who, preceded me. And then I somehow like, it's almost like this sense of like, wow, I just fell into this stream and I allowed it to take me on this journey. And I've just had the privilege of being able to do some incredible things in my life. And I have a just intense gratitude around it. It really, it feels special.
That's beautiful.
And you're part of that journey, babe.
They birthed us and they gave us their wisdom trickled down. Exactly. Sometimes we have to like separate the wheat from the chaff, in terms of the messaging, but it's all there.
Yeah. Yeah.
It's all there.
And, really I was thinking about this in anticipation of us coming together today. It was like, before C-section became so widespread, I mean, really, all of us are here because of, and I'm going to use the term yoni, I think, because part of the reason I adopted it when our girls were young was because it was something I learned when I was learning to suture for vaginas
Hmm.
after childbirth, because sometimes the vagina will tear.
Uh-huh.
And that was the term that was used in the book because the term vagina, which really is just referring to the inside part of the body, and it is associated, it's like a sheath, which obviously our vaginas are so much more than that. Um, that I like to use the word yoni, and for some reason now I've like completely lost my train of thought.
It's got some, well, because, okay, so we're both postmenopausal and this might happen a lot during.
Yeah.
No, it doesn't bother us. And if you can bear with us, you might find some humor in it too.
And someday you'll
that
relate,
you're
probably.
choosing to use yoni. I think historically, and in some ancient ways, yoni is actually a term that's been used that doesn't have any derogatory. I find I'm totally off the word vagina now that I know that it was named by men only for a place to rest their sword.
Their sword, yeah.
So I'm all for using yoni, and I don't feel like it's like not naming parts or sugarcoating it. Like, I'm super cool with using the name yoni. I want to well, before we actually get into my line of questioning. So I'm birthing Caleb in this room. My water broke. I had the child 3 hours later. He was a very fast birth. I had been torn. I'd had a 4th-degree tear when I birthed the child prior to Lily, and I was terrified. I had gone through hypnotherapy. I'd done all this stuff to be able to birth this child at home. I knew I didn't want to do it in a hospital. And when I'd never had the experience of popping open to 10 centimeters and having my bones disconnect so that this being could come out of my body. And I started screaming, I'm ripping, I'm tearing, I'm dying. And none of you can see it. And one of my children, the other one was in the other room thinking I was actually dying. But one of my children, Lily, was like in between my legs, like the midwives had to move her out of the way. But I'm up here at the head of the bed going, you guys, I'm tearing and I'm going to bleed to death. And do you remember what you did?
Yes.
What did you do?
I got right in your face. And
Right
I looked you right in the eyes. And I was like, you got to give birth to this baby. Push.
That's right. You said, you're not fucking dying. Look in my eyes right now and breathe with me. You need to push.
Yeah.
And that was all I needed.
Yeah.
I just needed someone to take charge of my terror.
Yeah. It gives me chills because I'll tell you, that's what a midwife did with me with Story when she was born. I was terrified. I was at 10 centimeters. It was time to push. And she just got right in my face. And I could still see her face right now. And it's exactly what I needed.
That is matrilineal wisdom.
Yes.
That is and then you used it with me.
Yeah.
I've used it with patients.
Yeah.
It's like incredible. Well, you just need someone to take charge. Could you imagine being Lucy in a field alone? I mean, I guess you had no choice than to go with the flow, but it's a mental.
I believe that Lucy had other female support.
So Lucy Lucy is a reference point of our first recorded bipedal humanoid-esque-ish female that gave birth to, how do we know about this whole giving birth in a field part of Lucy? I mean, she's in your...
Well, because she wasn't in a hospital.
We're talking...
Well, it was her, I think her skeleton was found, right, by anthropologists, and they were able to date it and figure out that she was, one of the, I mean, I can't remember.
She's 4 foot something.
Yeah.
I can't remember how old she was.
Yeah. But... And which sort of Homo erectus versus, Homo sapien, but she was in that lineage.
So a lot of, well, at least in my hippie birthing class, it was like, listen, Lucy did this in a field. And so can you. You can do it at home. And so I think about just birth without technology, right? That it's changed so much. Okay, I'm totally digressing. I really just wanted to remind you that we birthed a baby together in this room. But here's
we're honoring the yoni,
and we're honoring and matrilineal wisdom, which I'm all about.
Yeah.
Okay, so. First, I'm going to ask you a question about you, and then we'll go into the line of questioning. What's the thing the women in your life never talked about? And what did that silence cost you?
Oh, wow. What a great question. Um, we didn't talk about periods or sex. There wasn't really talking. There were books, and there were pretty good books, actually.
Oh,
Like,
nice.
I was a kid growing up in the 70s, and I felt like it was a time where, there was just sort of a better recognition of like, we have to be able to like have things that are accessible for children. There was a book actually it was about the Red Stone, and it was about the very first girl to have her period. And I remember reading that. And it had a whole sort of spiritual element to it, which I really appreciated as well. But yeah, my mom was not comfortable talking to me about those things.
Mhm.
And yeah, I think that silence is one that is tricky because we, as a result, have these things happening in our bodies and we don't really know, we have questions and curiosities and we don't know where to turn.
Mhm.
And thankfully, a magical woman came into my life, Melinda, because we were about 11 years old, and she and I sort of walked the journey of puberty together. And I feel so blessed because we were able to talk about these things with each other. Um, and she had a very different upbringing, and so I think some of this was a little bit more open for her than it was for me. And so again, it's like I feel like these magical women show up in my life. And like I said, you are one of these magical women as well. And they just kind of help us along these pieces of our journey, right?
We life together.
Yeah, and
We're partners. We
we are
partner.
partners, and maybe in some ways it's not an inappropriate actual, way to do that because I think that that time is so precious as young girls when you are coming into that time of puberty.
Mhm.
Um,
So you're saying that, like, having these magical women walk this with you helped you through the silence. Books were good, but that the talking didn't normalize. It kept it maybe separate or other or away from, and that by having someone like Melinda, you were able to more embody the experience of becoming a fertile woman,
yeah, thank you for
understanding of it.
helping me like actually articulate what I was
Hey,
trying to say.
postmenopausal women and podcast hosts are
Yeah.
very good at doing that. So I have a question for you.
Okay.
I don't want to. Do you have more that you would like to share about this?
Um, yeah, no, I think that's it. I mean, part of it too is like we don't know what we don't know, right?
Yeah.
It's like that was how my upbringing was, and it was how I
Mhm.
came into it, and so.
Mm.
But yeah, I think as a result, it's it can be kind of a scary journey. And
Yeah.
maybe if you don't find somebody who can be your little buddy in that, it's hard.
Yeah.
It's hard.
Absolutely.
Yeah.
Absolutely. Okay. Question number one.
Okay.
In your clinical experience, what are the most common vaginal health concerns you see across the different life stages? And are there patterns that surprise people?
It was so funny because I started like writing responses to these things. And I was like, oh my gosh, I don't know how long this podcast will be because I could do a
Be
dissertation
as
on like
long as we want it, baby.
on each one. So I would say, my focus has been on taking care of women, probably since around puberty. Now I've been extending my care of women into their postmenopausal years into their 80s, and it's actually a beautiful, incredible journey. A lot of it is focused on women during their reproductive years, and I would say there's kind of two of the most two common vaginal infections that women get. One of them is bacterial vaginosis, also known as BV. The other one is yeast infections, also is like vulvovaginal candidiasis. And what I want to back up and say is that I have being a midwife, I have such a tremendous respect for the body, the woman's body, and the metamorphoses that we go through. And our bodies are super wise. And the vagina is its own self-cleaning mechanism, right? it may
Would you just repeat that?
The vagina is its own self-cleaning mechanism.
Here, here.
Yeah.
And so when certain symptoms come up, that's when you know you need to see the doctor. You don't need to maintain it
No.
unless you get itching,
Yeah.
burning,
Itching,
or
burning,
smelly.
a really foul odor like a dead fish is up there.
I have a good story about that. Do you want to hear a good story about that?
Of course.
So when I was in acupuncture school and I was studying women's health early during the master's, not the doctorate, my teacher from mainland China said, a healthy vagina, has a fish smell. And man, my hand just shot up and I was like, excuse me? And she said, a healthy vagina has a fish smell. And I was like, okay, I don't know what the standards are where you grew up. But here that is not the case. And she's like, no, here it is the case too. And I said, no, that's not possible. It took us like 15 minutes and I was adamant. I was like, I am not accepting that. And what we realized was that fresh fish has no smell. So we think of a fishy smell, we think of rotten fish or rancid oils of fish. And to a healthy fish eating person, fresh fish has no smell.
Has no smell.
It's fresh. It's almost a little maybe metallic-y or mineral-y.
Yeah, which is so true.
Which is the same for vaginas.
Yes, yes. That's so interesting. I love
know,
it.
But boy, she was mad at me and I was mad at her. She ended up being one of my greatest mentors, actually.
That is a great story.
Yeah.
I love it.
Anyway,
and I do actually, I'm so curious from the East Asian medicine standpoint, like understanding what, vaginal candida or bacterial vaginosis, sort of what's from your philosophy, like what's going on there. But let's just say this, a lot of products have been pushed on women to clean the vagina. And what we actually end up doing when we use those products is we interfere with the normal microbiome. Microbiome, now we understand, like it happens in our gut. It also happens in our vagina, happens in our mouth.
And they're important. They're important to health and our ability to fight infection. It's part of our immune system.
Yes, exactly. And we all know that like there's bacteria that support all of how our body functions. And so the bacteria in the vagina are called lactobacilli, and they produce lactic acid. And the vagina is an acid environment. It's quite hostile.
But tell them why. Tell them why.
To keep stuff from growing, like bacteria.
And tell them when that changes.
So when the pH gets thrown off.
Well, when it changes when you get sick, but if you did not, so the increased cervical mucus during ovulation creates a coating on the vagina so that sperm can pass, because the normal pH of the vagina kills sperm.
Yes.
Our bodies are amazing.
Yes. Yes.
So that when you get all that discharge when you're fertile, it's to allow the passage of sperm. Like all the sperm race myth theory, like all of that stuff, like it is all up to the woman. We accept or we reject, including a follicle to get pregnant. Anyway, I'm going to totally digress. I'm going to save that for another podcast. But yes, like our vagina takes care of itself.
It does take care of itself. Yes. And you're right. The pH, this is such a cool thing, actually. So if you look at cervical mucus that is at the time of ovulation, it looks like, raw egg whites. Under a microscope, you let it dry. It does what's called a ferning. And the beautiful thing is that you see the same pattern when you're checking to see if a pregnant woman's bag of waters have broken. You take a sample of the fluid that comes from the vagina. If it's broken and it dries and you look on a slide under a microscope, it's ferning.
No kidding.
Kind of magical.
That's totally magical.
Isn't it?
So like we talk about all the geometric patterns of nature. I think they might have left ferns out.
I know. And ferns are like totally... I mean, the crystalline structures are just, it's one of my favorite things. It gives me chills every time, like when I would check slides for checking for amniotic fluid. I was like, oh, there's ferning.
Oh, that's really cool.
It's very cool. So yeah, so that egg white kind of like vaginal fluid that we have at ovulation is slippery, and it's helping the sperm to access and get, up into the uterus and then up into the fallopian tubes to fertilize the egg. So it probably just changed the vaginal pH a little bit. Like it would, I actually don't know all the different like pHs. Generally, our pH is about 4.5
Mm.
on the scale, 7 being neutral, right? Now, what happens with like sperm will throw off your vaginal pH. It's higher. So if you have had a lot of sex, it could be that your pH is, thrown off a bit. And that I think sometimes can actually cause a bacterial
You
infection.
become more
You become
vulnerable
more
because
vulnerable.
the pH is too high.
Exactly. Because I will tell you, there is bacteria in your vagina all the time. It's co-located right next to your rectum. And so it's just a normal thing that there is bacteria about that down there, but your body is designed to prevent infections by keeping that pH
But
low.
it's also why we're supposed to wipe front to back.
Yes, that's why
Because
we're
if
supposed to
it's too overloaded with E. coli, you're going to end up with this infection. So East Asian medicine looks at these things, one from an immune system perspective, and two from the introduction of something pathological. And when you have the combination, you get dampness and wind, as in yeast infections, right? Or you get damp heat. Or dampness and toxic heat, as in bacterial vaginosis, BV,
Okay.
which is harder to treat. Not a lot of people are super stoked about doing like herbal douches to get rid of bacterial vaginosis. And because it can turn to pelvic inflammatory disease so easily, I generally don't treat bacterial vaginosis with vaginal douches, but I will give herbs so that they can get rid of it with their antibiotics the first time. But yeah, it's definitely a Chinese medicine thing, and it's not modern world. Like,
Yeah.
it's been around.
Yeah. No, I think it's been around for
And
a long time.
also, I feel like
I was going to say one other thing too.
yeah.
Blood changes the vaginal pH. So for women who, for whatever reasons, might be on a birth control method that causes a lot of spotting and bleeding, that can make them more susceptible to having bacterial vaginosis. I want to say that I don't think of it as bacterial vaginosis actually as easily causing PID, pelvic inflammatory disease. I'm more concerned if you have like chlamydia or gonorrhea with that.
Yeah, those are definites if you don't get them treated.
Not that you shouldn't treat your bacterial vaginosis. You should. And sometimes there's certain situations, like we don't consider bacterial vaginosis or vaginal candida to be necessarily sexually transmitted. However, you will find that sometimes you will see patients, the female partner who gets like these is just can't seem to clear it. And in those cases, it's very helpful to actually treat the partner. And there was a recent article actually in the New York Times about doing that. So if that is an issue where you're for some reason not able to clear it, then one thing we would recommend is treating the partners as well.
So we are going to talk about sex a little bit in terms of vaginal health, because I think that you just segued into it perfectly. So one of the things that I talk about with women is that spit is one of the nastiest, like lubrication, like love-making, sex, bootylicious sharing fluids out there. Our spit is just loaded with bacteria. So for some people, and tell me if you find this, so women with new partners will tend to have more BV and more yeast infections in the beginning of the relationship until they adjust to one another's microbiome.
I think that's totally fascinating. And that may totally be true.
I mean, I've had that experience.
Okay.
You've been married a long time.
True.
I've been married a short time.
I'm used to the microbiome of that person.
And when I have people that are having repeated bacterial vaginosis and they come to me because they're like, I don't want to be on any more antibiotics, I say, do you use, how much oral sex do you have? And do you use spit as a lubricant? And if they say no, I say, just give yourself a break for a couple of months with spit. You can use other lubricants.
Yeah.
Always, let's see, lubricants should be water soluble and it should have no glycerin. Okay, first of all. But then, like the gut, especially for perimenopausal women and postmenopausal women, with the lack of estrogen, and we're going to go into GSM or genitourinary syndrome, menopause syndrome soon. But as our gut microbiome changes, as our hormones fluctuate, we become even more susceptible. So we'll get into that in a little bit. But yes, spit is not, if you're having BV a lot, and then you're getting yeast infections a lot because you're on the antibiotics, look into how much spit y'all are using.
Yeah, I think that's an interesting perspective. The other thing I do want to talk about is the lubricants,
Mm.
because the vagina is a mucous membrane just like your mouth. So things are very easily absorbed through there. And I don't usually like name products, but there is a brand called Good Clean Love because it's natural. And that's what I tell people, to just choose something that is, you just don't want any chemicals in
Good
that
shout
part
out
of
for
your
Good Clean
Good
Love.
Clean Love. Yeah.
Great. I
Yeah.
like that. Thank you for that. Now that we're already into sex, how do you talk to patients about vaginal health in a way that feels normalized rather than clinical, pathologized, or embarrassing?
This is such a privilege, I think, of doing the work that I do. And I think you probably find this too in your work. Like, patients are coming to me for usually I'm examining an intimate part of their body.
Mm-hmm.
It just, and so in some ways it's like, um, it just happens. People, they ask, they will go there. And I think if I feel like if I've created a comfortable enough, container, then they go there because they have questions. And I love those questions. They're amazing. So I don't know how to actually, I don't know if I could go through the steps of how to make it, how to get to that place. Part of it probably is just, it's taken me years of experience of being able to hold space with women in a way where I am really grounded and comfortable in myself in a way that people feel comfortable enough to open up to me.
Yeah.
But it does feel incredibly special. And I talk about sex pretty much all day long because people have questions about it. So I don't know, did we want to talk a little bit about GSM, like the
We're going to get
genital?
into it. So I'm going to go into different phases of life.
Okay.
So for anybody who's listening that's in puberty or adolescence or has a daughter in puberty or adolescence, what should young women and girls know about vaginal discharge, odor, and we already went through the pH part, that they're typically not taught?
Okay. I love this question. Because one of the first things is people will talk about, like, I have all this vaginal discharge. And I'll be like, okay. And then we'll go through, like, what other symptoms do you have? Is there burning? Is there itching? Is there a really foul odor? And then sometimes they'll be like, no, there's none of that. And I'll be like, okay. And I'll be, like, I'll do an exam. We will test to see if there's anything abnormal. But it might be that your body is producing extravaginal discharge because it's cleaning itself. And I'd be like, it's a good sign. Like, it's doing the job that it needs to do.
Or they've started to ovulate.
Good point. Yeah.
We
Especially if they're
before we menstruate.
Yeah, exactly.
And young women get really juicy.
Yeah.
I mean, sans, other hormonal systemic issues.
Yes.
And they don't know that's normal. They think that something's wrong.
Yeah. Yeah. We don't know what we don't know, right? And so I would totally prefer people come in and ask the questions and me be able to say, I can reassure you that what you're experiencing is normal. Or I can say, oh, actually, there is something here and we need to, treat that, whatever it is.
So how early do you believe that parents that are comfortable talking about such things should address or begin conversations about vaginal health or vaginal microbiome?
Well, it's interesting because I can remember, when our kids were little, part of what they talk about is actually from a really young age, like from their, babies. Just when you talk about their bodies, you acknowledge every part of their body. Like, you don't skip over. You don't go be like, this is your belly button and then these are your knees. Like, you actually address like that. There's another whole section here, right? And so obviously you're not talking about the microbiome at that point. You really got to, I think with young, with everybody, actually, I'm not going to say just with young, you have to meet people where they are.
Yeah.
So if your child is asking questions, I think you just acknowledge, you answer them kind of matter of factly and just know that it's a safe space for them to ask these questions.
Do you know one of the things I found now, having raised, I mean, we all raised each other's children. We probably could say I had 15 kids because we all had different jobs with each other's children.
Mm.
One of our good friends' sons call us the Marmy, the mom army. But one of the things I created with my children that a lot of my patients have found is very helpful information was I created something called Switzerland.
Mm.
And it was a place where we could go talk. I made a pot of tea and got a bar of dark chocolate. And we go up in my bedroom, we sit back to back. So if there was something I wanted to share, if I wanted to talk about sex, it was very important for me raising sons to talk about what a woman's body does when she's into a sexual encounter, not just her words, right? What happens to breathing? What happens to, what if the vagina gets dry? What is that a sign that might be happening? What happens to vocalization? What do hips do that are really into sex? Meaning that if the vagina's dry, her breathing is shallow, her face is turned away from you, and she's not moving, you better check in.
Yeah.
Anyway, so Switzerland was a place to have those conversations with boys, but also because I find that just eye to eye changed the conversation.
Yeah.
Switzerland was also used where they could tell me anything without there being consequences, but they had to trust that as an adult, my job was to keep everybody safe. So like if all kinds of shit went down in middle school with everybody in middle school.
Yeah.
So Switzerland I find was a great way to talk about sex and sexual things with my children. We also created something called the Isis Sparkles for our daughters.
Yes.
Which I have been told many times since then was a terrible idea, but
Really?
It wasn't a terrible idea. Yeah, we had all of our daughters together and we talked about it. The book, The Red Tent, had just come out.
Yeah.
We really just wanted to steal each other's kids at the full moon and anoint them with oils in the dirt. Make them, this punk rocker, sound like a hippie. But the Isis Sparkles is a group that we created with all of the daughters and there was like 8 or 10 of them to talk about what menses was, vaginal health, normal things if they were starting to feel horny. We sewed like menstrual supply bags and made sure that everybody knew which moms lived closest in case they bled through when they got. But you know what we didn't do, which my daughter was shocked by? She might kill me for saying this on air, but she said, "You never taught us that your menses happened more than once."
Oh.
She's like, "I thought it came and it went." She said, "What a shock when I got it."
And it was just a one-time thing. Oh, that's so funny.
For the rest of your life, sweet cheeks, until it wasn't enough.
I will make a comment about that because I think that the timing of that kind of thing is so important. And it's about 8 years old with a girl. You have to get them before they're there, and there's something about being an 8-year-old girl that you're actually quite open. And then they kind of started to hit that, getting closer and closer to that age. It lasted a couple of years, and then they were like, "Yeah, I don't think," and then they need their space to go and kind of figure this out a little bit on their own, and that's so fine. And I love your idea of Switzerland.
Yeah, Switzerland worked really well in this household, I have to say. So I just want to reiterate or make sure that I understand you correctly that products, right, douches, as scented washes, pH balancing products are all harmful to the natural self-cleaning mechanism of your vagina, and that you should be concerned if really heavy discharge lasts more than 3 or 4 days. Yeah.
Yeah. I mean, I think if anything feels like it's really weird and out of the ordinary for you, come on in. Like get checked by somebody to reassure yourself.
Yeah, like steady yellow or green color, bad smells, itching, burning.
For sure. And then I will say, in terms of like things that, we'll use to treat these infections, there are, for yeast infections, there's vaginal yeast cream. So this you do apply internally. Some people will get also, it's sort of the equivalent of what I think of as male jock itch. It will show up sometimes more in the vulva on the outside and maybe less so internally. So sometimes that's where you need to apply it more. Similarly, for like a bacterial infection, there's a vaginal antibiotic gel. There's also oral medications for treating yeast and oral antibiotics for bacterial vaginosis. I will say I do have a bias that I will share. I prefer to treat these locally because they're local infections versus with a pill because that's going all over your body.
Mhm.
And
And maybe killing some beneficial yeast in your body. It's not everything's pathological.
exactly. And we know with antibiotics, right, it can change other things in your like gut microbiome, which can like, if you use antibiotics, it's very common to get a yeast infection
'Cause
because
it's
you're killing off the normal vaginal bacteria that would produce the lactic acid and keep that pH
and
down.
even if you're taking an antibiotic for an ear infection, like,
Yes.
that's what you mean by systemic. Yep.
Exactly,
Great.
exactly. And then I want to mention one other thing.
Yeah.
Sometimes we will use boric acid suppositories for BV that's people are having challenges with like clearing.
Mhm.
And so like recently I had a patient where she was struggling with that and I was like, okay, we're going to try this, metronidazole gel again. And if that doesn't work, I want you to do 2 weeks of boric acid
Yeah.
suppositories. And there are over-the-counter vaginal boric acid suppositories that you can buy.
Is Vagifem one of those?
I do not remember the brand. I think Azo
Mm.
produces them.
Mhm.
Yeah, I think, I'm not directing people towards a particular brand
Of
for that
course.
one.
But I'm always looking for sponsorship, so no,
Oh,
I'm just
okay.
kidding, I'm just kidding. Okay, I
Azo.
have some so in terms of, pregnancy and postpartum, so this also all this applies and almost especially applies that when you're pregnant, like, and freshly postpartum, like, don't be putting anything up there because that is anything in terms of products, like, that declare to
Yes.
make you like,
Yes, yes.
douches and
You
stuff.
can do things called sitz baths where you just, it's a warm bath with like Epsom salts and maybe like an herbal infusion to help with tissue healing. But you usually don't want to go more than about 3 to 4 inches, sitting in there. But it can really support if you've had some kind of vaginal lacerations that required
Mhm.
repair. That can really help with tissue healing. In general, we do recommend, probably about 6 weeks of not having sex. And
Let me ask this question before you
oh,
get
go
into
for it.
that, because I have a feeling that they're gonna tie into each other, and if not, I apologize. How do pregnancy and the postpartum period change vaginal tissue, flora, and function? And what's often overlooked in postpartum care?
Oh, those are big questions. So,
What does it
yeah.
tie into the 6 weeks postpartum part?
Yeah, let's just focus on during pregnancy. Women in pregnancy are just juicier.
I call it a state of grace,
Yeah.
right? Like you've got vaginal discharge, you're leaking urine, your nose is stuffed, you're snoring, your body odor smells different from the hormones. I just say eventually you're lactating. I'm just like
Yes.
it's a state of
And
grace.
your blood volume increases by like an extra like a third or something like that. So you are just juicier. So a lot of pregnant women will talk about having increased vaginal discharge, but won't necessarily have an infection. And then in terms of postpartum, there's such huge hormone swings that happen postpartum, right? Because during pregnancy, you've had progesterone dominating, and then that will completely drop off. And so, actually, what women will find postpartum and with breastfeeding, especially if you're breastfeeding, the vagina can actually be quite a bit drier.
Hmm.
So, with resumption of sex, I'll often recommend using a lubricant
What
to just,
lubricants do you suggest postpartum that are safe?
I would stick with Good Clean Love.
Hmm.
hmm I
Over
would,
coconut oil products?
I mean, if you've used that in the past and you're comfortable with it and that's your go-to and it's not like causing problems, yeah, great. Great.
Great.
It's just, yeah, I'm like, just really be careful with chemical-y stuff. But yeah, coconut oil, and just things, look at that ingredient list really carefully and make sure
Hmm.
you're using something that's very natural and clean. Um, and, I think women, I want to just say like some women are ready to have sex sooner. Like that it's like, that's not like, a hard and fast. But there is something about the first 40 days. And it's an interesting thing because I know it correlates
Chinese
with,
medicine,
East
yeah,
Asian
East Asian
medicine.
medicine, it's huge.
And then similarly with the population I take care of, which is a large proportion of Latina women, they talk about like los 40 días, like there's something about the 40 days. And, so people should do what works well for them. But giving birth to your baby is just a huge endeavor. I mean, going through pregnancy is a huge endeavor. And then, the work of giving birth to your baby is a huge endeavor, and giving your body time to recover from
So
that.
listen to your own internal wisdom.
Exactly.
Let it be a somatic experience. Have that feedback tell you what you should do.
Yeah, your body's wise.
Yeah, our bodies have tremendous wisdom. So the first 40 days in East Asian medicine is a big deal. So birthing the canal. So we have something called the dantian, which is the area between the belly button and the base of your perineum. And it is it is the seat of your precious jingqi, which is responsible for your growth and development and the rate and health at which you age. It is also the spark that adds the fire to getting pregnant and growing another human. So when we give birth and we open ourselves by 10 centimeters and, average 6 to 8 pound human comes out of there, you expose the opening of this precious Mingmen fire area, this dantian, the place where your jing rests, to the external world. And and women died in labor a lot. Like, women age in 7-year cycles in East Asian medicine, and it ends at age 49. Right? Um,
How are we
which
still here?
Well, I just wrote about this because it's very interesting. Puberty is happening earlier, and girls are starting to menstruate earlier. It used to be 14, 15. The average is now 12.5.
Yeah.
Menopause is occurring earlier from what it was. Can be like 35, where it used to be like 42, I think it was. Don't hold me to these numbers. And also women are having babies later. And so this whole system that was, written in the Huangdi Neijing 2,200 years ago needs a little adjusting, and we're adjusting for it. But the first 40 days has to do with the body's ability to close and protect that precious, the vagina is called the Yin Dao and the Jade Valley. So for that to close back up, because it is the entrance and exit of heaven. I know. In East Asian medicine, a mother is merely the conduit between not a Christian heaven, but between the life-giving essence of being heaven and the unborn. We are simply a conduit. So opening that up and letting that creation out makes us tremendously vulnerable, which makes sense because so many women also died in childbirth.
Yeah.
But allowing time for it to close, the hormones which open your pores, how much we sweat after we give birth, letting that all consolidate again to also reduce our vulnerability to exogenous disease, and then to give us time to rebuild our qi and blood that we've lost in the process of not just growing a human, but then birthing a human. And so that's the first 40 days. There's a wonderful book, East Asian Medicine Recovery After Birth, called The First 40 Days.
It is really good. I highly recommend that. It's got a whole bunch of like dietary recommendations. We're thinking of the same
It's
one.
like how to do it. It's a how-to, and it's how to eat and how to sleep and how to hydrate and temperature of like fluids, everything.
Yeah.
Sorry, I just took your thunder there for a moment, but I wanted to share that.
It's huge. I want to just give a shout out because I've seen now a couple of things, these are like on social media around, in other countries. Unfortunately, we don't have this as much here, but where they do things to help women recover from birth a lot differently. I think in Korea, it's pretty common for women to go to, it's actually sort of like a really nice, it seems like sort of like a spa where you spend at least the first 2 weeks, you and your baby, and just really allowing yourself to just transition,
Getting nourished,
and I think that the sense of really honoring that, from a cultural standpoint, like, wow. And then similarly with in France, I just learned about how they have a whole program to support women, with the pelvic floor and sort of that kind of therapy that goes for a couple of months postpartum. And unfortunately, like these are things that we really should try to work towards adopting here and that should be covered for all women.
Agreed.
Yeah,
It should be essential primary care
it should be.
because we give life.
We do. And it's no small thing.
It's not a small thing. Yeah. All right, I'm gonna wrap up the kind of reproductive years
Great.
section.
Okay.
We are, yeah. I have so many more questions for you. How does hormonal contraception affect vaginal health and the microbiome? And is this something women are adequately counseled about?
Well, I'm going to answer your second part. No.
Not adequately.
I don't think we're
counseled.
adequately counseling at all, partially because I actually don't know that there's not a lot of good information out there.
Mhm.
I think what happens is anecdotally women will come in complaining of different symptoms around hormonal contraception. One of, and these are, I'm going to talk purely anecdotally, but like I will see women who use like a Mirena IUD and seem to have more common yeast infections. It's not across the board. But some women, it just seems to be like an issue. They're like, I got this IUD. I keep getting yeast infections. So, we're all individuals, right? And so when we take these hormones into our bodies, they all kind of interact with our own systems differently. And so I can't say that there's across the board, you're going to see the same thing for every person. But if you are noticing symptoms that aren't feeling good to you in your vagina or frankly anywhere else in your body, so for some women, it shows up as increased acne, which is interesting because we often think of hormones acting to decrease acne. But sometimes that happens with both the hormonal IUD and also there's a hormonal shot that some women will have increased acne. I think sometimes also a little bit more vaginal dryness because since you're not, often these things suppress ovulation, right? So you're not having that normal vaginal fluid with ovulation. And as a result, it changes, your vaginal microbiome, right? So I would say we are not counseling well enough. I think there's actually probably not enough information about it. And so what I really encourage women is like, if there's symptoms that they're not feeling good in your body, then come on in so that we can support what would be a better fit for you.
Totally.
Yeah.
Thank you. We're going to move to perimenopause and menopause, which is, my favorite part of women's health has always ended up being the one I'm in.
Yes, me too.
And it's so lovely to we both practice in a field that follows us throughout our own lives.
Right,
What a
exactly.
privilege
What a
that
privilege.
is. Totally.
Yes.
So can you walk us through what actually happens to vaginal tissue during the hormonal shifts of menopause, and then to back that up with the genitourinary syndrome of menopause, also known as GSM, as is terribly underdiagnosed because most clinicians aren't that aware of it. It wasn't taught. So that means it's also undertreated. And then afterwards, I want to know, why do you think that is? I think I know the answer that you're going to give there. And what do you wish every woman knew about that? So first, again, what happens to vaginal tissue during perimenopause and menopause? Let's talk about GSM. Why is it undiagnosed and untreated? And
So I am going to go back to my own education because at the time when I came through midwifery school, there was the Women Health Study that had just come out. It was in 2000.
WHI.
Yeah. And so the messaging to us was like, don't give hormones, don't do anything. It's dangerous. It's going to cause breast cancer. And so for a lot of my career, actually, that has been the truth. And I feel so grateful and fortunate that a shift happened basically at the time when, you and I were going through menopause, where we were realizing oh, wait a minute, this data was not interpreted correctly. And
in 6 or 7 different ways.
Yeah.
Which is also why black box warnings went on hormones, which have now been removed very, very recently.
Yes. Yes. And so for the generations of women before us, they just were well, suffer, figure it out, get through it,
Just the way it is.
And, I also underappreciated what the transition of menopause would be before going through it myself, because you kind of just hear it's hot flashes and night sweats and maybe mood changes. Right. And I think that the beautiful thing is now we're understanding how estrogen is just woven throughout our entire bodies
We have
and
estrogen
brains.
receptors
Yes,
everywhere.
everywhere, right?
Everywhere.
So things that we were thinking were not related to menopause, actually often we're realizing potentially are, like joint pain,
Mhm.
right? The only things we couldn't attribute to something else were the hot flashes and the night sweats, right? Because you think, oh, joint pain, you have arthritis. But actually, maybe part of what's happening is that with that withdrawal of estrogen, which is what's happening with menopause, right? Our estrogen, our ovaries they're not producing estrogen the same way. And they are going through huge fluctuations in the perimenopause period, right? Sometimes it'll surge and then sometimes it goes naders. And that's why it's like this roller coaster ride.
I think perimenopause is the hardest part of everybody talks about menopause, but perimenopause,
Yeah.
because it comes on so insidiously, you don't know what's
Yeah.
going on. You think you're crazy. I write about this a lot in the book. Oh, commercial break.
Yes.
Look, I got the cover of the book, The Energy Prescription, Ancient Wisdom and Modern Science for Thriving Through Menopause, written by yours truly, Jennifer Ashby. Wiley Publishing, comes out October 20th. If you'd like to order locally, you can get it on Pegasus, Oakland. If you're more of a Amazon, Barnes & Noble person, you can pre-order on there too. Okay, anyway, I write about that a lot in this book.
This book is excellent. I highly recommend it.
Thank you.
And
Erin
Jennifer,
has had to edit
yeah,
much of it.
she's an excellent writer. And her wisdom is you will every woman can benefit from it.
Thank you.
And
So
that helped me
perimenopause, vaginal
yeah.
changes.
I guess the vaginal changes. Yeah, perimenopause.
So we have estrogen receptors everywhere. And we get affected. Our joints get affected. Our brain is affected. Our gut microbiome is affected. Our hearts, our cardiovascular system entirety.
And our vaginas.
Yeah,
our
and
yonis.
our vaginas.
Yeah.
So what happens to the vagina?
Right. So one of the effects of the decrease in estrogen, right, is that our skin gets thinner. And that's everywhere, including the vagina. And there's actual architectural changes that happen, right? That our labia minora disappear.
Well, not really. They just get really small.
They get smaller. They reabsorb, right? But it's one of the things that, when I examine a patient, it's a way for me to get a sense kind of what's happening for them in their bodies.
Well, I got to go back. Do they really? I mean, I know women that are no longer having sex will often say that their lips disappear and shrivel up, that their vaginal opening closes and it seems impenetrable. And I know that women that continue with sexual activity, and sexual activity does not mean you have to have a partner.
Penetration.
Yeah. Thank you.
Yeah.
Tend to say that happens less. So is it really you don't use it, you lose it? And if you're going to use it, partnered or not, figure out how to do it comfortably with good lubricants, increases
vaginal estrogen cream,
and also just the friction internally and externally increases blood flow. And from an East Asian medicine perspective, the flow of qi along with blood that keeps tissue more healthy. So tell us more.
Yes, those are all true. So yes, it's a slow process. It's not like one day your labia minora are there and they're gone, but they do get smaller. And I think, vaginas in their 80s, I think it's mostly just the labia majora that are there. But though with sexual activity, it might kind of sort of help maintain more of that. So a lot of women complain of vaginal dryness and itching and irritation around this time. And so I'm a big proponent of vaginal estrogen, which is in a cream form, or you can also get it in a ring form, which is kind of nice because then for some people, I prefer it. It's just up there. I don't have to think about it. It's every 3 months.
Do the ring mate that, so these local estrogens are not, they say they're either not or much less systemic.
Mm-hmm.
So the cream I'm fine with. I'm a huge proponent of hormones. And I mean, if they're reducing any suffering when you're doing the rest of the lifestyle stuff, the vaginal estrogen ring, I know they said it wasn't systemic, but I was ready to go postal. I'm sorry, that might be offensive. I was ready to kill members of my family.
And that was the local,
It
just
was the estrone
Easter.
ring, yeah, the E string, and everybody,
Interesting. Okay.
I was mean to my sweet husband, I was mean to my kids, they were like, "What is up with you?" And I was like, "Oh, yeah, what is up with me?" I popped that little puppy out, and I was fine within 12 hours.
Yeah. Yeah.
So we're all have a very unique blueprint,
We
right?
do. We
And
do.
what worked for you, which is why I took it.
Yeah.
I might have even used the one you had left over or something. And not that she'd already used it. I'm sorry, I said that wrong. A freshie that
A
she
fresh
wasn't
one. It was,
using.
yeah. Package
And
was
I was
sealed.
just like, mm. But we all have unique blueprints. So what works for your girlfriends is not going to work for you necessarily. So when that estrogen declines, our pH changes in our vaginas because the lubrication changes, because
Yes.
we're not looking to get pregnant anymore, because we're not fertile anymore. And the fact that we're living longer and that we're vital longer, we all still want to have vitality, whether we're using it sexually or not. We want comfort. And the GSM is not just vaginal, though, is it? Right? Genitourinary. So
Oh, yes. Yeah.
this
Yeah.
complex of symptoms includes the bladder. So tell us more about that.
Well, where the urethra, and this is where I was like, I really need a
I know,
diagram.
I'm kind of bummed I needed a vagina for you to
Trying to think
show
of
the
like how I can
entire area.
the architecture, because it's right, it's located. Your urethra is basically right located, kind of below the clitoris, right below the hoods of the labia minora. And so, yeah, for what happens for a lot of women is bladder infections, and also problems with incontinence. So
Bladder irritation without infections. There's a
yeah,
lot of that.
yeah.
Yeah.
So I'm a big proponent for vaginal estrogen. And I tell women, because some women think, oh, it's just for sex. And I'm like, this is really not for sex. It's really just to help keep that tissue basically kind of plumper and functioning better longer. Because
Mhm.
like, Jennifer said, according to the 7-year cycles in East Asian medicine, at 49, we wouldn't be here anymore. And of course, we're living long beyond that. So this is a way to help support the health of your vagina for sex, but also just to help with things like if you are struggling with things like incontinence or increased bladder infections, the vaginal estrogen will just help keep those tissues, sort of plumper and more vital, so that you have more support around that. Now, there's a whole other thing we could talk about on how to support women around bladder incontinence and, yeah, infections and things like that. But I will just say that, yeah, I'm a big proponent of vaginal estrogen just for the health of your vagina, and through until, for as long as you can do it.
Mhm. Mhm.
um, and I think, well, actually, there was something else that you asked about that now. What was the next thing you wanted
It
to?
was well, I was talking about why do you think GSM is underdiagnosed and undertreated?
Oh, yeah, it's because clinicians weren't educated.
Mhm.
And unfortunately, it takes a lot of time, for whatever reasons, for these things to disseminate. Partially, I think, because it's like, you know, you have to have people who are focused on that and feel comfortable with it. And I'm, even working in the setting where I see patients, I'm talking to my colleagues about doing, hormone therapy for menopause, and how to
Mhm.
support women in a way to get them comfortable. And it's not
Mhm.
like it's rocket science, but it's like there's enough of like not being totally comfortable that, you just have to help people get over that edge.
Mhm. And clinicians were not taught, because I have to just put the thing in, it's a female problem.
Yeah.
And what was a very male-dominated field, Western
Yeah.
medicine, and so just like all other things, menopause, it was not looked at.
Yes, exactly. And I think also the culture of like, thinking of menopausal women as sort of like dried up and, kind of not worth anything
Past
anymore.
your prime. Oh, don't
Yeah.
get me started.
Yeah.
That's another podcast
Yeah.
yet to come. So how do you kind of approach the topic of sexual function and vaginal health with women who are postmenopausal, may feel like the conversation doesn't no longer applies to them?
Again, I think a lot of it is about, you just in the having been around enough that I can hold space in a way that people could feel comfortable bringing it up with me.
Mhm.
I often ask people, if are they having issues with sex? Like, is this a normal part of what my check-in
Right, are you having
is?
sex? Are you having any
Yes,
issues that I
exactly.
might be able to help with?
And some women aren't, and they are totally fine with that. Like, they're like, this is great. I don't need to do that anymore. And it's like, great. But then I've had patients, I had this one patient, she, I think was 80, and she was like in a new romantic relationship but hadn't had sex in a while and was like, I want to have sex again. I was like, oh my God, I want to help you have sex
Bless you,
again. Yes.
yeah.
And so part of the process was starting her on vaginal estrogen. And then because she hadn't had sex in a while, I advised her to start with vaginal dilators because it would take and patience because
Because of that shriveling up and
the
changing tissue.
tissue changes. Yeah, yeah. So it's a really key part of when I ever do an exam on a patient who is postmenopausal, a lot of the information I need to collect is like, are they having sex? How is it for them, if they're not, because it affects like what kind of speculum I use.
Mhm.
Because I know in terms, and then my thing always is like, if if I'm hurting you, I tell me, I will stop. Like there is
Yeah.
no reason why you have to endure.
Any kind of a
No,
pelvic
yes,
exam. Do you hear that? Nobody has to endure a pelvic exam. If it is uncomfortable and it is not working for you, you do not have to do it.
yes, yes,
I learned that from you.
yes.
I did. Okay. I have more
Okay.
questions. We haven't talked at all about the pelvic floor,
Mm,
and its role in vaginal health for women as we age, and what symptoms a woman might be experiencing when it might be time for them to be referred to a pelvic, I call them vagina PTs, a pelvic floor
yes,
physical therapist, which is
yeah,
actually an entire department and career that is very, very busy where I work at UCSF.
yeah. They're not enough. We need more. We need more. If you have an interest and you want to go into pelvic floor PT, please.
Mm.
Oh gosh, this is a huge one. I would say, so I would just say if you've had a baby, and it doesn't matter if it came, if that baby was born via C-section or vaginally, just having gone through pregnancy, your pelvic floor takes a hit. And ideally, doing pelvic floor PT post any pregnancy, I think would be really important. Now, if you haven't had pregnancy, then the signs would be things like, if you're having trouble with urinary incontinence, you're sneezing, you're coughing, and the pee is coming out. I would definitely recommend you seek pelvic floor PT. And then I was gonna say something else, and now I left my
It's okay.
brain.
We are postmenopausal. We have complete leeway here. We have a very wide berth for acceptance. If it comes back to you, great.
Okay.
If not, no big deal. My next big question is lifestyle, because that's my big thing.
Hmm.
Of all the lifestyle recommendations in terms of vaginal health, and I think that this
It
probably,
came back to me.
oh, good, go, go.
Okay, I'm going to talk about ways to pee because there was a lot of things I
Oh,
was doing wrong and I've learned not to do them anymore. Like, but if you go to a public toilet and you're not comfortable because it's like you don't want to sit down, put the toilet paper down and sit down. One of the worst things that we can do that I've learned from pelvic floor physical therapies is to try to like
hover.
hover over a toilet as well as pee because you're contracting and trying to release at the same time.
Oh, interesting.
So bad, bad, bad,
No
bad.
hovering.
No
Put the
hovering.
toilet paper down.
Exactly. Put the toilet paper down. And then I think also, allowing yourself to complete peeing. Like,
Oh, this is a big thing for me.
yeah.
I have a trick. I can help with this.
Okay. Yes. Yes.
At the end, so our bladders are like our brain.
Mm-hmm.
There's a neuroplasticity to them where they can be trained,
Mm-hmm.
right? I do a lot of bladder training with people, anyway, with certain age or medications. And so here's the trick. at the end of each pee, because your bladder's like, whatever, oh, it's been 42 seconds, I'm done. Whether you've fully evacuated or not, it doesn't care. It's like, okay, it's done time. You stop it when you think you're done, and you take 3 slow, deep breaths. And sometimes you'll be absolutely amazed at how much urine comes out.
Yeah.
What are your tricks?
Yeah. I do. So I have these little qigong things that I do at the end. One of which is like I take my hands and I rub them together. I have this little ritual that I'll do, and then I give myself a chi facial.
Oh, you
And
get them warm.
I wipe like around my face and then around my neck. And then it's similar to your concept. I think I'm just pausing. And I think it's also a little bit of a nervous system reset. Cause like sometimes if you've been holding your pee a while, like that bladder sphincter kind of isn't releasing completely.
You're contracted. Yeah.
And you really got to let it release completely. So I love the 3 breaths. I think whatever you can do to allow yourself to complete urination, let yourself do that.
Yeah.
The other tips I give are like avoiding too much caffeine or alcohol, because those can contribute to incontinence.
Bladder irritation for sure.
Yeah. And
certain supplements also contribute to bladder irritation.
Yeah. If you're on medication, certain medication can cause that too.
What other lifestyle stuff? Diet, hydration, sleep. Like, how does all of this affect vaginal health?
So hydration, I think, is super important. For some people who really struggle with incontinence, because some people underhydrate, right? Because they don't want to have to pee so frequently. And I'm like a minimum of 6 glasses of water per day.
I have solutions for this. So first of all, I tell people we are the only mammals that think that we're not supposed to pee all the time. We're the only mammals that think that urination is an inconvenience. It's so ludicrous. Like, go to Africa, go on safari. Everything just munch, look, lick, scratch, pee. So that is not healthy. The other thing is, if you want to know how much water you should drink, you'll hear me say this probably in every single podcast. It is your weight in pounds. So let's say you're 150 divided by 2. So it would be 75.
Right.
That is the minimum number of ounces of water you should drink every night. And for those of us who have night urination stuff, stop drinking your fluids an hour and a half to 2 hours before bed.
I do tell people
And those last 2 urinations of the night, make sure you do your 3 deep breaths to fully evacuate. And if you find that you're peeing too much at night, you can work to actually retrain your bladder.
Yeah.
But yeah, hydration is the unsung hero of fatigue, like overheating and hot flashes. Like, hydration can contribute to so much. Menstruation, where do you think your menstrual blood comes from? Air? Like, hydration, it takes fluid. Lactation, breast milk. I have a list in the book that talks about all the things that hydration does, and it is astounding. People are like, I had no idea. So hydration. Diet. What about diet and vaginal health?
Yeah, so this, with patients who have like a lot of vaginal yeast infections, I will kind of check in around things around like how much, sort of sugar, carbohydrate type things they're taking in, or also, potentially do they have diabetes? Because diabetics unfortunately do have increased risk for vaginal yeast infections. Lifestyle, interestingly, like yeast infections can often come on with stress. So people are having a lot of stress in their lives. They'll probably get more frequent yeast infections.
Chronic stress is a systemic issue.
Yeah. Well, cortisol is a hormone, right? And cortisol is a hormone. It's going to affect, for women, I mean, for men too, but it's going to affect all these different parts of our systems. And so it can show up in our vaginas.
And cortisol in itself is not pathological. Chronic release of high levels of cortisol is the issue. Cortisol is naturally occurring and we need it.
Yeah.
But lifestyle does affect our vaginal microbiome and therefore our vaginal health.
Yeah.
Okay. I have 2 more questions and then we're going to be done. How does vaginal health differ across racial and ethnic backgrounds? And are there disparities in how women are diagnosed or treated?
That is a great question that I actually don't feel qualified to answer.
Okay. I'm going to say
Yeah,
yes.
yeah.
I'm
I
going to
think
say
that there
yes.
probably are differences. I would say the population of women that I've taken care of have been, mostly white or Latina, and then some African American. Um,
I also appreciate your honesty.
yeah,
Thank
yeah. So I think it's a great question, but I don't know that I know.
you. All right.
Yeah,
So, ready?
yeah.
If you could give every woman listening one piece of advice about protecting vaginal health across her lifetime, what would that piece of advice be?
Oh, I guess I go and think about like what I would have given my young self, I think. And it would really be about trusting your body, and really, our lives are so, the modern life is fast paced and moving quickly. And often, we aren't quiet and pause enough. And I am so guilty of this. Growing up in an urban environment too, I think like I wasn't in nature a lot. I was in like, the city, which has got its own biome, and I appreciate what it's given to me. But I really, I wish, yeah, that we would all be able to kind of like honor the wisdom of our bodies,
Mhm.
and trust that our bodies know what is off and what is okay. And when you have a sense like something is off, seek help, seek support.
Mhm.
And if you go to somebody and they're like, no, you're not off, everything's fine. And you're like, but no, 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 something's really off. Seek somebody else.
Great
Trust your
advice.
intuition.
Great advice. There's a whole bit about our gut microbiome actually being like our first defender evolutionarily against what is right and what is wrong, is
Mm.
sensing things to know for our own survival. I
Mhm.
don't think that any of that is obsolete or lacks validity in modern day. And I think that in terms of our own health, and I do believe that we are in another revolutionary phase of matrilineal wisdom and knowledge and power, that yes, if you feel that something is off in your vagina, anywhere in your body,
Yes.
yeah, you be your own self advocate. And if you can't
Yes.
advocate for yourself, find someone that you're comfortable
Yes.
doing it for you.
Exactly. Can I ask you a question?
Of course.
Okay. I actually want to go back to hydration
Mhm.
because I am curious about, and this I would love to know from like an East Asian medicine standpoint, if like water, or are there other ways to support good hydration? Like sometimes I feel like for some people, water doesn't get absorbed the same way into the cells,
Mm.
because water has to be, there's an osmotic pressure, right, that pulls water into your cells. And I feel like I just am curious, and I don't know if you may not have an answer for it, but I'm just like, I'm thinking about things to help support hydration, right? Because the point is hydration.
The point is hydration. So
Yeah.
you can overhydrate and not be absorbing by just drinking water. And especially if like
And
you're sweating a lot. So postpartum,
yeah.
like,
And pull minerals, right, from
and
your system?
yes,
Yeah.
exactly.
Yeah.
So I am not an expert on this. I'm an expert on drinking water and getting people to drink their minimum quota,
Yeah.
but on the mechanisms of actions to actually pull water into cells, I do
Yeah.
not have. What I know is that permeability, just like standing in a pool, like water goes to the area of most concentration to least concentration, and so if you're
Right.
not pulling it into your cells, there's probably a deeper pathophysiology that's happening there that you should get someone much more qualified than myself to answer. But if you are sweating and you are losing essential minerals, it is important that you supplement with electrolytes.
Yeah.
It is important that you don't. So people will front load hydration. Your body can't absorb it like that.
Mm.
Right. So sipping throughout the day. Also, ice cold water, from an East Asian medicine perspective, ice cold water is not good. You think about it like, Think about it like a creek in the winter where it snows, right? When things are cold, they stagnate and they stop to flow. So for cold and raw things in East Asian medicine, we have to put the energy into warming them up before we get the benefits of them. So we believe in sipping all day long. I have to pre-measure. So I get my at minimum 1.5 liters a day. And then for me, sipping all day long, and I drink a lot of tea, sipping all day long, I have to have the right vessel. So I'm really into like, I can't see how much water, although I'm drinking out of a glass right now. I like to not see it, and I need a silicone straw. If I'm not digging the flavor, because where we live, sometimes at the end of summer, it starts tasting a little like pond water. Even though I have a filter on my water. I'll muddle berries or cucumber, or I put a little like food grade lemon oil from doTERRA in there, something that helps me along. But front loading or chugging a bunch of water in the beginning because you think you're not going to be able to do it later, you don't absorb water well that way. So sipping throughout the day, room temperature or warm, is much more accessible. Your body doesn't have to put any water and any energy into warming it up. And then if you are a big sweater, be it postpartum, be it athleticism, or be it menopausal, perimenopausal, menopausal sweating, electrolyte replacement can really help.
Excellent.
So yeah, I can't talk about the permeability of cells, but I can tell you what I know.
Or what I wonder about is like foods that have a lot of water in them, like watermelon.
So there are foods that hydrate.
Yeah.
In Chinese medicine, if you don't want to do it, they tend to be really sugary things, except for a cucumber. So you don't want to spike your blood sugars either. Eating too much cucumbers, too much watermelon actually causes an issue with dampness in the body. Some is fine, but often people will think that they're hungry when they're actually thirsty. So some foods can hydrate if that's all you've got, but they're not really a good replacement for just good old fashioned water. Or herbal tea. Herbal tea counts, but when you start putting in drinks that have color, sugar, any additives in them, including some, like a lot of bubbly waters have sodium, you're giving your body a job. They have to filter out impurities, and therefore you're not just getting the full benefit of just water or herbal tea hydration.
Thank you. Yes, it does.
Wow. So we are almost an hour and a half in. We've done an amazing job. Thank you.
Can we end with the song?
Oh, yeah. First, I'll say goodbye, and then I'm going to let Erin play her vagina song, Drake's vagina song. I want to thank you so much, Erin, for imparting your wisdom on us. It's such a joy to have you here in the room, that we have birthed a baby together, and our decades-long friendship and my love for you. I was so stoked when you said you'd come and chat on Ovary-Acting with me.
This has been so fun.
Yeah, it is fun. And let's pray to God when we shut it off, all the technology works.
Yeah.
This is Ovary-Acting. I am your host, Dr. Jennifer Ashby, which I totally forgot to introduce myself at the beginning. And I am so glad you've been here. We will now end with a song by Drake about airing out that vagina.
Okay, here we go. Rich Baby Daddy featuring Sexy Red.
And you can just, I don't know what copyrights are, but hold it up to your mic.
Bend that ass over. Let that coochie breathe. Shake that ass, bitch. Hands all you need. Hands all you need. Hands all you need.
It's fabulous. Thank you all for joining us. Until next time. Bye-bye. Let that coochie breathe.
Let that coochie breathe. Yes.